At JW Sommer Rehabilitation Unit, our job is to help you. We are the area's only acute rehabilitation hospital, and that's what makes us different from everyone else. And because we are an acute rehab hospital, not everyone who needs rehabilitation will qualify to be a patient here. If you're being shown this presentation, it's because your medical team has determined that you or a family member might be a good fit. We specialize in several different types of problems. These might include patients who have had a stroke, hip fracture, joint replacement, amputation, brain injury, or multiple trauma. We also provide care for wounds, pulmonary disease, pain management, diabetes, and neurological disorders. We have specialists here at JW Sommer who are trained to work with patients who have these acute problems, because our goal is to help you regain your independence. Our care program for you is specifically tailored to your individual needs. To become a patient at JW Sommer, you must be medically stable and be able to participate in at least 3 hours of therapy every day. And you must be sufficiently alert to participate. We're special because we can offer 24-hour-a-day nursing supervision, and we will check to see that you demonstrate impairment in 2 or more of the following areas: cognition, communication, continence, mobility, self-care activities, and safety. If you qualify, we'll design a program of care for you. If you have had a stroke, our treatment team includes physical, occupational, and speech therapists, as well as nurses. If you have suffered from a hip fracture or joint replacement, our team of physical and occupational therapists and nurses will work with you to provide increased mobility and pain management to return you to the tasks of everyday life. Our goal is to return you to walking without assistance, regaining your balance, prevent future falls, strengthen muscles, build endurance, and complete everyday tasks more easily. There's even an apartment here that you may spend time in to learn or relearn the basic skills you will need to be able to function independently when you return home. Upon arrival, you will be assessed by the rehab team, and a treatment plan will be customized especially for you. Your treatment plan will include physical therapy, occupational therapy, nursing care, speech therapy if needed, and more. Because we are an acute care hospital, medical care is right here on site. Your medical condition will be monitored closely. Your care team meets weekly to discuss your care. And as you progress, we provide family education for you and your caregivers to ensure a safe transition home. Case management will assist you and your loved ones in determining whether you will need additional services at discharge, such as home health or outpatient therapy. We want to help you regain independence and quality of life. While you are here, a physical medicine and rehabilitation physician will monitor your progress with therapy. A medical doctor will visit you daily and respond to any medical needs. Your medical care program will be implemented by rehab nurses with help from a case manager. Our occupational therapists will teach skills like bathing, dressing, eating, and food preparation. Physical therapists will focus on movement and safety. Speech-language therapists work with speech and swallowing disorders. Respiratory therapists can administer oxygen and breathing treatments. If needed, a dietitian can be consulted to ensure proper nutritional needs are being met. We have full-service radiology and laboratory departments available around the clock, as well as an emergency room at Shoals Hospital should your medical care require immediate assistance. Dr. Ronald McCoy is not only a referring physician, he's a former patient of the JW Sommer Rehabilitation Unit. Here's his story.
Well, Father's Day 2 years ago, we had the kids over to meet the kids, and they'd gone home, and I went in to do some paperwork and watched the news and sat down and decided to get up. 30 minutes later, I couldn't stand or walk. I had this just terrible pain in the back. And I guess I was there 2 weeks, roughly, with all the diagnosis and everything, not quite. And they said they wanted me to stay down there in rehab, and I didn't want to do that. Our group had helped open J.W. Sommer, and I do all of them, and they accepted me and brought me back there. Every morning you go through the ritual of being cleaned up and gotten up, and then you do physical therapy a good deal of the morning, and then back for lunch, and then physical therapy intensive in the afternoon. They're very knowledgeable, and they can be pretty firm with you. They're very personal. They're just kind, but they don't take no for an answer. I mean, you find out real quick who's in charge. It's certainly the best unit up in North Alabama, and I think inclusive of even Huntsville. It's a very intensive care type rehab. You have to be very sick to get in there. They just, by their rules, Medicare, Medicaid, insurance rules, they've chosen to be the elite. Again, it's the place you want to be if you can get in there.
The best part of our acute rehab program? Not only do we increase your functional independence, we improve your self-esteem and quality of life, and promote the safe return to work, play, and living. We strive to provide you the best care possible, and we're part of a hospital system that earned a 96% satisfaction rating from Press Ganey. Ready to become a patient? Our nurse liaison will give you information about our daily rehab routine and what to bring. We want to help you get back into your life. That's our job at J.W. Sommer Rehabilitation Unit.